Okay, good morning everybody. Welcome to our Board of Health meeting here. We will just go ahead and dive right in. So first thing was minutes from our December 18th meeting. Did everyone have a chance to review those?
Mm-hmm.
Any comments or questions?
I would move to approve those.
Okay, we have a motion to approve.
Agree.
Okay. We'll say Ken's a second then. And then all in favor of approving the December minutes?
Aye.
Aye.
Opposed? Great. Okay. I don't really have any old business to go through, so we'll just dive into some new stuff. There's a couple of things for the board here. Well, first, I guess, is that you, I think, are all aware that we do have a new Board of Health member who was unable to attend this meeting. The commissioners appointed Laura Weir to the Board of Health, so she will, her first meeting will be our next one, which is June, March, April, May, June. Yeah. So she'll be in attendance at our June meeting. The next thing I have for you guys is, so Elaine, that resigned from the board, was our very long-standing note taker, our secretary. So Austin is helping us out today, but I'll leave it to you guys to select someone else, another board member, to take minutes for future meetings.
I think we should have Laura do it.
Exactly, since she's not here.
I mean,
That's how I got secretary of the landfill district. I missed a meeting.
I second Laura.
Okay, great.
Okay.
I'm just gonna assume that she will accept this nomination. I think that's probably fine. So, all in favor of Laura being the board secretary?
Aye.
Aye.
Any opposed? Okay, Laura Weir. I'll text her and let her know she's on vacation. Right
Sorry,
now.
was that Barb that second?
Yes, I think so. It was Barb that seconded, or Barb that, not, yeah. Okay. The next thing, I think you guys are all aware, I've sent over some information about it. One of the major professional public health associations, called Confluence Public Health Alliance, is doing for the first time ever a Board of Health track during their April conference. And so I just wanted to make sure you guys were all aware of that. I brought a copy of the agenda along for some folks to look at. We already have Barb and Laura are actually both going to attend already, but it's in Helena. It's on April 8th and 9th. And they're going to be covering things like the local Board of Health roles and authority, sort of the current and future issues and challenges for boards of health in Montana, some strategies for effective meetings and engagement, and then the role of the Board of Health in public health advocacy and policy making. So I think it'll be a really good session. I'm excited to see how it goes. They're trying to get a Board of Health member from every jurisdiction in the state, so I'm very proud that Teton County is bringing 2 representatives, which is wonderful, but just want to make sure everyone was aware of it. And if you guys want to check out the agenda at all, if anybody still wants to register, there's definitely still space to do so.
Do you know if, this is Carmen, do you know if they're gonna record any of that you could access it online or anything like that on a later date?
Yeah, I don't know for sure that they are, Carmen, but I will ask that question and see if I can find out for you. And then I think if nothing else, we are 2 Board of Health representatives that do attend, and we'll make sure to have some space in our next meeting so they can kind of share any lessons learned with the rest of you. But I'll ask about recordings. I know it's hard to get
Thank
away.
you.
Yep. Okay. So next, in terms of health department updates, I just wanted to make you guys aware of some staffing changes. So Marsha Quillen is no longer with the health department. She is moving on to other job, so we were very sorry to see her go. She did a lot for us. And we are sort of in the process of restructuring a little bit in terms of job duties. We have hired another part-time nurse to help out, particularly with vaccinations and communicable disease, and she is one that is probably familiar to you guys. Dawn Baker came back to the health department, so she's going to be she's going to be working with us 2 days a week, typically Wednesdays and Thursdays, although the schedule might be a little bit variable. We're very excited to have her back because she's, of course, experienced and already knows a lot of the things going into it. We've had a few changes in the health department, such as the implementation of our EHR, so we're working on getting her trained up in that. But we're happy to have her back on board with us. And, I think we're going to sort of see how it goes. I am hoping that we'll find at some point a nurse that would be interested in working more or closer to full-time. But in the meantime, this is very helpful to us. Along those lines, I want to make sure you guys know Claire Hodgskiss. So Claire has been with us since last summer. Since July, yep. As she's a prevention specialist, so she took over the work that Darby used to do. And I think this is the first time you've made it to a Board of Health meeting, is that right?
Yes.
Yeah. So Claire is actually also increasing her hours. We're putting some of our chronic disease stuff on her plate, which is great. And then potentially we'll have some more behavioral health work for her, but we're happy to have somebody who's dedicated to that workload with a little bit more time in the office, so that's great. Okay, I think that's about it for staffing changes. Is that about it? So Ken had asked a little bit about some state and federal changes, impacts, that kind of thing.
Does it make sense to wait till the two get back from the meeting in April for the training?
Possibly, yeah. I mean, I can tell you right now what we're seeing because, of course, there's a lot going on in the Montana legislature and there's a lot going on at the federal level. And I think my updates at this point is, so far, nothing has really changed for us. I think our funding is fairly well diversified between, we do receive some CDC federal grant money that gets passed through the state and comes to us. We also have some state funding. We also have some county funding. We have pretty diversified funding, which in this moment is a good thing for us. I think the programs that are going to be at the biggest risk for changes at the federal level would be things like our diabetes prevention program, our cancer screening program, our WIC program, but the Congress passing the budget means our WIC funding is good again until September, until they have to vote on it again or whatever. So at this point in time, we really haven't seen a lot of changes. Yeah, and I think, time will tell. Like, we're halfway through the Montana legislative session, which has been a whirlwind. But we will, I think, at our next meeting, we can give any updates on things that might have changed around that. There hasn't been nearly as much brought forward this time around Board of Health authorities as there was 2 years ago in Montana. But still lots of rules around immunizations and some environmental stuff too that's been coming up. So yeah. I have any other questions about that at this point in time? I'm going to pass those around. So you guys, and I apologize, I don't really have this on for the two of you online. Maybe I'll see if I can hold it up for you a little bit so you guys can take a glance. Okay. So this is our communicable disease update for right now. I pulled flu numbers. So the chart on the top is flu numbers from October 1st, from the beginning of flu season. So across the bottom is the MMWR year. So starting that first week of October through basically through yesterday. Well, I guess week 11, there's nothing reported yet. That's this week. So what we're looking at is just flu activity We are still very much on the upswing, I would say. There's been a lot of flu going around. I think even this week we've seen quite a few new reports come in. So I would say we're in peak flu season. It doesn't look like we're declining just yet. In our routine surveillance calls with the schools, we're hearing a lot of kids out sick in the schools. Knock on wood, no outbreaks in long-term care recently in this in the last quarter here, but lots of flu activity. 3 flu hospitalizations in the last couple of weeks here, 2 of which were children, which I don't love, but just lots and lots of influenza. It's all influenza A going around. There have been 7 COVID cases since the start of the year that have been reported to us. So that seems low. I mean, we know that that's underreported in terms of what's going around, but some COVID activity. 2 STD cases, and then we've had 1 varicella case since the start of the year as well. So, which again, don't love seeing those vaccine preventable diseases popping up in Teton County. In terms of measles, that's, I know, been on everybody's mind lately. So there has not been a case of measles in Montana since 1990. We would love to see it stay that way. But I think some of the lessons that we're learning in West Texas and New Mexico right now, frankly, I think Montana is going to be pretty vulnerable to measles because of pockets of low vaccination across the state. We are getting lots of phone calls and public inquiries about vaccination status. I would say the majority of those are coming from older folks who do not need vaccination. There is sort of a funny little window in the 1960s where there was 2 versions of the vaccine, a killed version that was not very effective and a live attenuated version that came out a few years later. And so there are some people who it might be recommended that they do a booster dose of MMR if they were born, I want to say, between 1963 and 1967. And so those folks are, of course, welcome to call us and find out. We've had a handful of those. Usually our first recommendation is to go back and see if they can find a record of vaccination, or if they had a vaccine after 1967, then they won't need another one. So
what happens if they get one and didn't need it? Anything?
No, I think it's a relatively safe vaccine. It is a live vaccine. It can give you a little immune response, but generally speaking, if we don't know somebody's vaccination status, or even if we know they were vaccinated but we don't know which vaccine they got, the recommendation is for them to get that vaccine. Yeah, and it won't hurt them. There are titer tests that people can do to find out their protection against measles, but typically we only see that in a healthcare setting. So, that's not something that's routinely done for the adult population. It's typically folks that are working in a healthcare setting. We have had a handful of kids come in and get those MMRs that have honestly never been vaccinated for anything and just came in to get the MMR. Which is fine. I mean, we're happy to do that. We've been using, more of that MMR vaccine than we ever have before. Addition. It's routinely given at age 1, and so I'd say the majority of our families are still routinely vaccinating their children on time. But yeah, handful of kids that haven't had anything. I think what pops into my mind is that, I understand the media coverage of measles, and I think we are, a vulnerable state and community towards it. We've also had 2 influenza hospitalizations in the last couple of weeks for children, and so it makes me. I feel like I understand the fear around measles. I would also like to see people be getting all of their vaccinations so that we're preventing any of these, illnesses, hospitalizations due to these illnesses that we can. So. Any questions about measles or
Those years,
go ahead.
oh, I'm sorry, it's from 1963 to 1967?
Yeah, so people who were, so if you were born before 1957, measles was endemic enough that you don't need to be vaccinated. There's an assumption that you probably had it and have immunity. It's for those that were born in the 60s when there was that killed version of the vaccine that was out. And so after 1967, they stopped using that version, but I think the first measles vaccines came out in 1963, and then they switched over to the more effective version in 1968, basically after 1967. And so there's a tiny window in there of 4 years where it is possible that someone was given that killed version of the vaccine and they may need a booster if that's what they have. So yeah.
Okay.
I know it's hard to like say it in so few words that it's clear to everybody, but we just encourage people to give us a call and we can talk it through with them if they're not sure, if they're concerned about it. Any other questions about measles or communicable disease? I think in terms of preparedness for measles, what we're going to just try to do is, and we have some of these tools, but we basically just want to have conversations with the schools so they're ready ahead of time, because that's where I think we worry that this is going to hit the hardest. So making sure that they have information about what, for kids that are not vaccinated, what exclusion would look like, because it's like a 21-day exclusion from the schools. Which is a long time, and I think might catch some families off guard. And then also working, of course, with our healthcare providers in terms of preparedness for, if somebody did step into your waiting room, what those exposures might look like, infection control, all of those kinds of things. So we're going to work on compiling those resources and making sure they get shared across the county. Okay. So influenza immunization and COVID immunization update. I forgot to pull the numbers of how many we've done in total, but we have. It continues to be steady. The bulk of our vaccinations were done in October, November. Katie, do you know off the top of your head about how many we did? I think we were at like around 800 for immunization. No, is that right? 800 for influenza and maybe 300 for COVID.
It was like close to adding together to be like about 1,000.
Yeah, okay.
Total.
So I think that's kind of ballpark. And again, we continue to get people to come in. We have those vaccines still available for all ages, 6 months and older. And again, we are hitting peak influenza season right now. So it is not too late to get your shot if you have not done so already. Do you want to talk about, oh dear, did I just click something? Okay, well, I don't know what
I'll
just
pass
happened,
these out
but
while
go
you're
ahead
doing
and-
that.
Yeah. Sorry guys, I think we cut out for a minute.
Yep.
Okay, sorry. Okay, Katie's going to give a brief update now on just our immunization billing, and then she can do our PEP plans as well.
Okay. So I'm passing out 2 sheets. One is for last year, one is for this year. Working on some March and April. I've had some like weird billing things, just like complicated family lives. That's been new. That's been interesting to mitigate. And that they popped up in April, which is some of that money that's missing. And then October, I'm really pleased with where it's sitting with no correction. So October being our biggest month, I always that's kind of how I gauge how like things are kind of going with billing, because we see the most people. And so I feel pretty good at sitting at 85% with really no corrections yet. I mean, I've done some corrections on every single month, but I usually hit hardest on the ones that are gonna be done here pretty soon. Any questions, I guess? Do you want to show them? I don't know if they want to see it, but.
Yeah, I think it's gonna be hard. I can email these out to you guys online, sorry. I think it'd be hard to see the,
Lost them again.
oh, we lost them again. Gosh, it's supposed to be the internet here.
Any questions or anything I can
Sorry, you
go
guys.
over for you guys? Okay.
Do you want to do the pet plans?
Yeah, okay, so, I believe, yeah. Okay, so we have 2 FEP plans for this quarter that we're supposed to go over. One is the all hazard laboratory specimen transport plan checklist. The only things that changed from the last time you guys saw it is just changing out Marcia for me. Other than that, the language is the same since the last time you guys signed off on it. And then same thing with the communicable disease response plan. The only thing that changed was switching it over from Marcia to me. But the plan, I think for the most part, stayed the same based on the notes that I'm seeing. Do you want to go over anything else with it? Or
Did you guys have a chance to look it over? Did everything look okay?
I didn't look at it, but
It hasn't really changed.
yeah.
A couple of names in there changed is all.
Yeah, so I just need 2 signatures. I just need I guess a couple signatures. I need the chair to sign this one. Looks like I need Sam and Gary to sign that one. And then Gary needs to sign this one also.
Okay. Carmen and Barb, any comments on FET plans at all?
No.
Nope, I'm good.
Sounds good.
Thanks.
Yeah. Okay, I just wanted to give you guys a couple of other updates here. And I'm so sorry, my internet is like painfully slow in here. And so I'm having a little trouble getting this up, but I'm gonna see if I can share. So the community health assessment, it was completed, and then we've been working on the CHIP. So the community health assessment is available on the county website or by reaching out to the health department. But I think that all came together really nicely with some great, data collection. We were able to use our same strategies for collecting primary data in terms of community surveys and focus groups, all of that. I think we've been through some of this before. So anyway, all of this has led into our process around the CHIP, and the CHIP has not been published yet, but we are getting very close. We've had 2 community meetings. One we did in person, and then we did another one virtually. So we had some good weigh-in from various sectors, and I think the next step is really just to present that to everybody and get some organizational buy-in. The 2 sort of priority areas, so I guess the way we sort of split it up this time is to have some strategic directions and then priority health areas. So the 2 priority areas are behavioral health, mental health and substance use disorder sort of together, and then family and social supports. And the strategic directions were just kind of revolving around community collaboration, partnership was one, and then the other one was increased professional development. And so what those strategies look like is really revolving around, increasing. So the professional capacity piece is really around like providing trainings for like our first responders in the realm of behavioral health, or for teachers, or for other professionals in their field that are working with that are impacted by behavioral health and or working with families. And some of those strategies also were interestingly around supporting aging populations, that kind of thing, those respite care services, all of that. And then the community collaboration is, again, just connection to those existing resources. Katie, what else pops out in your mind is, I don't have the draft chip up because I don't know if my internet is fast enough to be able to get it up, but It was interesting. The group really talked a lot about opportunities for people to have social connection, and there's some fun things happening through like extension, that sort of thing. But you know, and then helping to address some of the barriers that prevent people from being able to engage in those existing activities, that kind of thing. So it was some sort of creative ideas and some interesting things. We saw good representation from the healthcare system, and they are excited to work on you know, better integration between behavioral and health and physical health, which is wonderful. We have a lot of opportunities coming up for potential telehealth services, particularly in the realm of behavioral health. So talking about leveraging those opportunities, we know that they don't work for everybody, but they do work for some people, and that can kind of reduce the burden of we have a lack of maybe counselors available to our communities, and so accessing that telehealth, accessing sort of paraprofessionals in the realm of both the family and social supports and behavioral health, but support groups, you know, maybe peer supports, maybe case management, that kind of stuff. So some interesting ideas that we'll be looking forward to exploring over the next 3 years. So as soon as that chip comes out, we will send it out to you guys to take a look at. So, but again, very, I guess not surprising in terms of the priorities that were selected. Again, behavioral health just continues to come to the top in Teton County. And again, I'm sorry, I was going to pull up the draft of the chip, but it took a really long time to get the CHA open, so I'm not sure it's going to make it. And it's really just in a draft form at this point. Let's see. Any questions about CHA or chip? It's always kind of a long process, but it's worthwhile. Okay. I just want to make sure you guys are aware of the Pathways program that we're participating in. So this is, it's kind of it's based around public health accreditation, but it's like a sort of a slimmed down program. So Teton County is one of 6 or 7 counties in a cohort that are receiving funding to work towards that. And it ends up being a lot of like policy procedure writing, that kind of thing, to kind of firm up some of our processes, and you know, make sure that the work that we're doing is meeting certain standards. So
And also like branding, which is
which is all part of it, like making sure our health
Just
department is, you know, marketed in an adequate way, and that kind of thing. So consistency, all of that stuff. So we just started on that after the first of the year. We're getting, it's not a lot, but it's maybe like $30,000 a year that we're receiving from the state health department to be part of that cohort, which gives us a little bit of, you know, funding for some travel and training, and a little bit of extra staff time to work on those projects. So far hasn't been too much. I think we're about to get into some of the heavier stuff of it, but I know some of the projects we're going to be working on in the near future are going to be like strategic planning for the health department, and then like performance management, performance tracking. Any questions about the Pathways program? Okay. I'm going to let Claire talk a little bit about some of the things. I don't know if I prepared you much for this, but I'm going to let her talk about some of the things that she's doing as prevention specialist. I think the one thing, big thing that I did want to make you guys aware of is that there was a funding opportunity through the governor's future generation. That was that $300 million to go towards behavioral health work in the state. There was a lot of conversation statewide about how that funding would get used, and it got sliced up in all kinds of different ways for different funding opportunities. There was a piece of the pie that was set aside for public health to work towards behavioral health prevention in their communities. And it was set aside specifically for rural communities less than 10,000 people. And so we were encouraged to apply by the Montana Public Health Institute. They, along with one other agency, are providing sort of technical assistance. It's built into this grant to help improve behavioral health systems in these rural communities. And I think there's 10 slots. So we got our application in for that. We haven't heard yet. I think I've been told that they're going to start reviewing those applications April 1st. Oddly enough, because they were trying to maybe sort of bypass some of the state, I don't know, requirements, they pretty much said it was a first come, first serve. Like if you met all the requirements of the grant application, they would take the first 10. So I got ours in real fast. And I'm fingers crossed that Teton County is selected. That will be $250,000 over 2 years, which is amazing to have that, to think about having that kind of funding to work towards behavioral health stuff. So we're really excited. They kept saying they were going to release it, and it took forever. But we were very, we were able to be proactive and have some conversations about what that might look like for Teton County. So we've already had some great conversations with partners around how we might be able to best utilize that funding to make an impact on the behavioral health system. So fingers crossed, Teton County gets selected for that. And Claire, do you want to talk a little bit more?
Just sort of a related point, there was one weekend we transported 3 suicide potentials. Two in their young 20s, one older.
Oh,
So some of the stuff that we're looking at that we can do now, not having to necessarily wait for the grant, is Casey DeVries from Conrad is going to do an adult mental health first aid course for EMS. So that is specifically adults working with adults who are in a mental health crisis. We're also looking at, there are a few people who are able to do the youth mental health first aid, so maybe working with the school systems, right, and able to identify our youth who are more at risk right now. I am looking at taking that training so that I can provide the training for our county, but we do have other options in the meantime while we're waiting for me to do that. I am currently meeting with all the schools in our county to make sure that they're feeling supported, as well as kind of seeing where they're at with their students and what they're feeling maybe their needs are right now, and maybe where they're needing some more support from us. I've met with Dutton. I have a meeting with Power today, and then it's just kind of throughout the next couple weeks meeting with the rest of them. And looking at like with that piece, right, is like the crisis diversion. So I believe Ryan Olson, who I can't remember the name of Ryan Olson, who comes in and does like the crisis diversion. So like working with like police stations or sheriff's office.
He works with dispatch, so
Yeah.
integrate 988.
Yeah. So for dispatch as well as like the officers who are responding to these calls kind of know how to integrate 988 and when to use it and just working on that liability piece, because I guess there's a huge liability piece because you can't show up at a place and then just leave. So,
Also, it turns out dispatch is so complicated across the state. I had no idea. It's not just one cohesive system. It is many, many, many different systems in every community.
And so with the prevention role that I have right now, we're also, doing our monthly CARES meetings. So we have people from the medical profession, EMS, other first responders, other stakeholders in the community meet once a month. Our meeting is actually going to be tomorrow. I think today's Wednesday. Tomorrow, and we are doing a training on positive childhood experiences. Anyone would like to join? We're trying to bring people in to train for those meetings, that it's going to be really meaningful and really help with our impact on our community. I feel like there's something else, and if I remember, I will just hop in.
Yeah, I mean, Claire, I think, is doing a really wonderful job of sort of bridging partnerships. She's been working a lot with Shelby through Extension and partnering with Brianna through our tobacco use prevention program to just sort of find spaces to talk about behavioral health in collaboration with others, which is, I think, a great way to approach things. So, yeah. And then I guess with crisis diversion, that coalition, so that, if you guys recall, that funding is out of Pend Oreille County, but to do a whole North Central crisis diversion coalition, that group was able to hire a coordinator, which is a really big deal, because now somebody is actually dedicated to doing the work and progressing all of that stuff further. So she will actually be in town tomorrow to meet with some of us, and she's going to come to our CARES meeting as well and check out our local coalition, and then she'll be traveling all over north central Montana to get to know some of the other communities and starting to identify those spaces where we can better work together with our neighboring counties to address behavioral health crisis.
Oh, we also have, I just remembered, it's RBHI.
Oh,
So
sure.
Rural Behavioral Health Institute. It's a Montana-based company, and so what they do is they screen. They have schools enroll with them, and they do a screening to flag kids who are probably more at risk. But it's not just for suicide. It's like pretty broad, so it's any kind of behavioral health risk that they're screening for, and it's obviously we're an opt-in state. So parents can have to choose if they're going to opt in. But like the example she gave us that was pretty powerful is there, there was one school, only 17 kids opted in for it, and of those 17, 12 were flagged for at risk. So I'm also in my meetings with my schools bringing this up as well. Power's already signed up. It sounds like Fairfield is going to sign up. We're going to talk with Shoto about it. We've already talked with Dutton. We'll talk with Greenfield as well. It's for kids in grades 6 through 12. So.
Yeah, and I think the thing that's unique about the Rural Behavioral Health Institute is that there's a lot of programs out there that do these screeners, and can help identify kids. They are committed to making sure that those kids are connected to needed resources kind of within like a 24-hour period. And so that it gives these kids that are screened and flagged as high risk access to counselors, to services. And so it's different in that it isn't just saying like, oh, well, this kid could use some help. Good luck finding a counselor that's locally available where you could actually get them some, right? Like they're committed to making sure that these kids, they have a pretty broad network of providers. And so they're committed to making sure that these kids are assessed professionally, and connected to those resources pretty much immediately, which is great. Because I think that's what we hear from the schools a lot is that they can identify kids that might be struggling, but really have a hard time finding resources for them.
And it might be a combination of telehealth and in person too. So
Yeah.
Good.
Yeah. Let's see. I have maternal child health on here because Mandy was going to make it today, but she was not feeling well. So I think. I'm trying to think. I know we're talking about mothers and babies. That's, if you recall, that's our evidence-based programming around postpartum mood disorders.
We're doing a poll to see
Yep.
kind of when, but I think it's going to be sometime this summer. We'll do a mothers and babies course.
Yep.
I'm working with Mandy on that as well.
Yep. And so I think that's the major thing there. Our WIC clinic continues to be busy. With, again, some kids aging out, but some new ones coming along. So I kind of think that's about it for maternal child health at this point. Does anybody have questions about any of those programs or stuff going on in the health department? Okay, we'll let Austin give his update.
I actually don't have that much, so probably the bigger question is how is my job being affected by some federal changes? I don't have any federal sources of grants, so that's not really going to be much of a concern. Montana is still on the 2013 food code, so even if we do have decent changes from the FDA, it's going to probably be trickling down to larger establishments that sell on a cross-state line. Typical situation. It's not necessarily something that's going to filter down to restaurants, bars, that kind of thing. The one thing I've already noticed though is the USDA is backing off a little bit on what they want to be involved in. So for example, truck wrecks, if it's involving meat, typically we'd be able to just kind of hand off the investigation to them. They're no longer going to do that, but they still want to get updated on where everything ends up going. I don't think it really significantly changes our FEP plan because the plan is for us to just do the investigation and essentially fall food that's not safe to the dump. So that's just going to stay there. On the septic side of things, we might be seeing a lot more pressure dose systems. So one thing was nice about, or is still nice about being in a small county is we could get some exemptions from putting in a septic system in a high nitrate area. Those exemptions were changed last year, so basically you can't do a gravity fed system, which I know makes installers and homeowners kind of sad because gravity fed, it's kind of hard for it to fail. You don't have to have electricity. It's a lot easier to put in. You don't have to have any electrical experience. So that's just going to be maybe a kind of a learning hump that our installers are going to need to go through. And then we did get a subdivision approved that has a approval for level 2 treatment system, which means essentially household human waste is estimated to be around 50 milligrams per liter nitrate levels. A level 2 treatment system actually gets that number down to 24 before it even goes into the ground. In terms of prices of those, I'm not sure. I think it's expected to be at least 10,000 extra for an installation, probably more. But that's just because of high nitrate levels already in the area for just that one subdivision. But it might be something we see more. So far, we've only had approval for one in the county, so it's going to be a new thing definitely for us. I think that's pretty much all I have, though. Any questions for me?
I had one kind of complaint or comment on the auto garage on Main Street and 4th Northeast Dexter's, I think it is.
Sure.
About the
Number of cars there?
Yeah.
Yeah, I need to swing by Deschner's anyways. I would say that they're probably not going to be covered by the junk vehicle rules because businesses that are working on cars get a pretty long amount of time to where they can have a junk vehicle actually visible. So the rule there is if a car is not currently registered, or if it has permanent registration, that doesn't count. It's dismantled in some way and it doesn't run, you can't move it by its own power, then it's considered a junk vehicle. And those aren't allowed to be visible from the center of the street. However, of course, junkyards, auto mechanics, they have exemptions cut out. So if they're working on the car, they've got several months to get rid of them or remove them. But Deschner's always been pretty easy to work with. If I go through there and just point out a couple of his vehicles, he can move them behind his fence, no problem. But it's not going to be all of them. Most of them, I would say, don't qualify as JVs.
Okay.
I heard that not too long ago there might have been a pop-up tattoo artist at the Legion. Is that what we heard?
A what?
Tattoo artist that just kind of shows up and they don't typically stick around for very long.
No, I think it's come and gone, but
Yeah.
tattooing people in a bar.
Yeah.
No.
Well, that's my bar, and I don't know anything about it.
Oh, okay. Is that what I heard was the Legion? Is that, you guys didn't hear this? Oh, okay. Melody's nodding over there. Yes, that's what I heard was the Legion. Yeah.
We'll stop that.
Thank you.
Yeah. Right now we don't have anybody licensed for tattoos in Teton County.
Yeah, I did hear that they were somebody was gonna do tattoos at the Legion. Did that actually happen?
I think it did.
Oh, it did? Oh,
Yeah.
okay.
Oh, it did happen.
I think it did happen.
Oh, really? Oh, interesting, okay.
Do you think the bar manager said it was okay?
I
Or do you
don't
think the
know.
guy just showed it, Al showed
I
up?
don't know.
Okay, I'll figure that
It
out.
would be worth looking into, though.
Yeah.
I've got enough other problems.
Well, that's the first I heard of it, but yeah, I don't think there's any provisions for a mobile tattoo establishment.
Yeah.
The one that I wish there was one that I know Power was interested in, Farm Power Malt, was a mobile brewery.
Uh-huh.
But from looking at what the Department of Revenue had, I didn't think that was going to be an option.
Gotcha. Okay. Anything else? Okay, well, I think with that we can adjourn then. Anything from Barb and Carmen online?
I don't think so.
Okay, thanks you guys for being here.
Thanks, Melissa.
Thank you.